This is a helpful report that came out of the CDC on a study that looked at vaccine effectiveness. We've been watching it this year thinking it's not quite as effective as it has been in other years, and this study confirmed that the vaccine still is effective, especially against 3 of the components, but against the H3N2, which is the 4th component, not as effective. So the study says that people that are immunized have a 23% reduction in the risk of, or the likelihood that they'll get influenza. So putting that in context, since we've been studying vaccine effectiveness through the years, a really bad vaccine would be considered around 10%. A real great rock star vaccine would be 60 to 70% effective at preventing influenza in the people who get it. So 23% is a little bit on the low end, and it's a kind of an unfortunate year in the sense it's not a great vaccine for the one that is the most prevalent strain that also causes the most symptoms. But it's important for people to remember that if you get the vaccine and get the influenza, you're less likely to be as sick as if you didn't get the vaccine at all. There's some cross benefit, even if it doesn't completely prevent the infection. 23% reduction in the risk of an illness is a pretty good benefit, especially for something that's as safe as a vaccine is. Think about this. If somebody came up to you and said, I can give you something that's safe and effective and inexpensive, and it'll reduce your cancer risk by 23%, you'd snap it up. If you did the same thing with reducing heart disease risk factors, or the risk of getting it by 23%, you would get it immediately. So a 23% reduction in the risk of getting influenza is a terrific benefit. So yes, still get the vaccine. We still are in the middle of the flu season. It's come down a little bit. We're not seeing quite as many cases as we have been, but it's come down to where we were the last 2 years at this date and time. And the last 2 years were problem flu years. So we are still in the thick of the influenza season. Hopefully it won't spike back up again. If you haven't had the vaccine, still get the vaccine. I think there's always hope for that. There's getting to be more and more sophisticated genetic and molecular testing that tells us exactly the features of it. We're always looking for vaccines that target things that occur year to year, year in, year out on these different viruses. So I think the methodologies are going to improve every year. Now, but there always will be a lag time, because at some point you have to draw a line and say, okay, this is what's going to go in the vaccine. Now we have to go into the production mode. Now we have to go into the distribution mode, because it's got to get out to all the sites. And if you push that too far into the flu season and wait for the perfect vaccine, you're too late, and many people have already gotten it. So it's a balancing act.